The U.S. reached the terrible milestone of 200,000 deaths this week, according to data from the Johns Hopkins University, more than any other country. A new 22-second map by COVID Act now shows how the pandemic spread across the U.S. from state to state and provides an idea of the scale and speed of infection. As reported by Fast Company, the team of scientists and technologists at COVID Act Now produced the 22-second, color-coded animation showing the progression from early March until last week. The red shows the movement of infections from the northeast to engulf large parts of the west coast, southwest and southeast. By creating the time-lapse from over 3,000 U.S. counties since March, they noticed 5 key patterns. There is a striking similarity between the percentage of people staying home and cases per 100,000 people. If fewer people stay home, the cases increase. Where states such as New York enacted a mask requirement, cases were eventually contained. Whilst the animation shows that the rate spreads quickly within states, it highlights how differences in the management between states can lead to a metaphorical wall at state borders. An example is New Mexico and Arizona. The Arizona side of the border turned solid red in late July, but not in New Mexico, where infection rates were contained through mandatory mask wearing and a reduction in dining capacity. Premature reopenings, such as in the state of Georgia, led to further outbreaks despite early interventions to close schools and restaurants. The animation didn't find parallels between protests which had taken place on social justice in areas such as in California and New York, where precautions were taken, and sudden increases in infection rates in the same places. COVID Act Now is the same organization which created the COVID Response Simulator, allowing people to download a tool to map how they might respond to a local COVID-19 event. By inputting local data into the tool, they can simulate the impact of different levels of compliance with wearing masks, for instance. The organization also maps state-by-state infection rates and daily new cases.